I welcome you again into my YouTube channel, The World of Viruses. Again, my name is Professor Festus Sadu. Today, I want to introduce to us viruses as multi-organ pathogens. Viruses as multi-organ pathogens. Under this I'm going to classify those viral diseases as they affect the various organs in our body. From portal of entry, they go into other parts of the body. What actually do I mean by multi-organ pathogens? It means one single virus can infect the different organs in our body, starting from the respiratory tract, lower respiratory, upper respiratory tract, the lung, the liver, the kidney, the cardiovascular system, the urinary tract system, and so on and so forth. So they can all infect all these organs. They cause different clinical features in these different organs. This spread can also be by immunological attack as a release of cytokines and cytotoxic T cells. This is how they cause all the different organs. Now, I welcome us to the system-based viral infections. Let's start with eye infection. Viruses are the major cause of conjunctivitis. What do I mean by conjunctivitis? Conjunctivitis is the inflammation of the conjunctiva, the cover, in a layman's language, the cover of the eye. They are the major cause. One major virus here under this one is the adenovirus, which is the cause of conjunctivitis known as pink eye. You can see from the pink coloration of the picture on your left, the pink eye. This is a virus. This is a viral infection acquired through unchlorinated swimming pool. Other eye infection includes those caused by enterovirus 70, hemorrhagic conjunctivitis, the keratitis, hemorrhagic conjunctivitis, keratitis, and dendritic ulcer, which can also be caused by, which can also lead to permanent visual impairment. This is also caused by herpes simplex 1. And again, neonatal conjunctivitis, which is acquired during the passage of the baby through the birth canal during delivery. So, still now the next category, let's quickly look at the upper respiratory tract infection. What do I mean by the upper respiratory tract? The nose, the larynx, the pharynx, the nose, the heart palate, and so on and so forth. And here, a very good picture of the viruses using this portal of entry, the nose, the larynx, the pharynx, the upper respiratory tract as the portal of entry. A very good virus here that we can't but mention is the Coxsackie A virus, which is the cause of hyperangina. It's actually the cause of hyperangina, which is characterized by sudden fever, sore throat, vomiting, and vesiculopapular lesions in the tongue, tonsils, and in the palate. Again, it's the major cause of foot, hand, and mouth disease. Fever, vesicular lesions is the cause of vesicular lesions, characterized by vesicular lesions, blisters of the palate and hand and mouth. In fact, that's why the virus is, the name is derived. Still on upper respiratory tract infection. Again, here we see the HSV1 and HSV2 infection, which is the major cause of gingival stomatitis in children. Let me show you the picture of gingival stomatitis. Yes, very good. You see on the far right, you see the inflammation of the whole buccal cavity. This is caused by HSV1 or HSV2, and it's very, very common in young adults. And again, on the side by side with that is the cold blister. I know some of you must have had a cold blister before, which is usually in the lip. It's also caused by HSV1 or HSV2. They may progress to severe fatal encephalitis. That's one danger of this disease. They may progress because it's very close to the central nervous system, to the brain. They may progress to encephalitis, fetal encephalitis, and meningitis, especially in immunocompromised or in babies that are still not having antibody. Latent infection of the nervous system can even occur as a result of the travel of the virus through retrograde axonal travel to the peripheral organ. Please, let's note all this. upper respiratory tract infection. Still on that, very important virus, EBV, a short form for Epstein-Barr virus. Epstein-Barr virus is the major cause of infectious mononucleosis. A disease very common, very, very common. Antibody is found against this disease in nearly 50 to 80% of the world population. And it's usually acquired. It's also acquired through kissing. That's why it's also referred to as kissing disease. Systemic disease is systemic disease of children and young adults, characterized by fever, sore throat, enlarged lymph node, spleen. The EBV is also the major causative agent of Burkitt lymphoma. Let me show you the picture of a Burkitt lymphoma. You see it, very ugly picture there. EBV is the major causative agent of Burkitt lymphoma. This disease was first recognized among Uganda children in East Africa. One common thing about this EBV virus is that it produces what we know as heterophile antibodies. There's no other virus where we see heterophile antibodies. It's only in EBV, and it's very, very diagnostic. It's very, very diagnostic of this disease. Let's see the next group, lower respiratory tract infection. Lower respiratory tract infection normally starts as respiratory infection, as upper respiratory. That is, of course, is understood. Influenza virus, influenza virus is the major cause here. It's the cause of croup, backing cough, very, very common in the pediatric world. Common in pediatric world is the major cause of infant pneumonia. And RSV, respiratory syncytial virus, is the major cause of bronchiolitis, which may progress to pneumonia. See it in the picture on your right. This is on the lower respiratory tract in the lungs. And of course, influenza itself, we are very much familiar with influenza. It's a major cause of rhinotracheitis. It's also associated with Guillain-Barré syndrome and Reyes syndrome. Yes, one here, a child that is having influenza virus, that is having influenza infection, should never be treated with aspirin, because aspirin will eventually lead to Reyes syndrome. Please let us know that. Again, a virus that of recent the world is just recovering from, SARS-CoV, is the major cause of severe acute respiratory syndrome. SARS, COVID-19. The world is just recovering from COVID-19 right now. And of course, the acute respiratory disease among recruits. This is very, very common among recruits, especially in the trench, when they are in the trench fighting the war. This acute respiratory disease is very, very common. These are all categorized under lower respiratory tract infection. Let's see the next one, which is gastrointestinal infection. As the name implies, these are in viral infection of the intestine, both large and small intestines. Viruses are almost responsible for 2/3 of infected diarrhea. What do we see here? They are characterized by vomiting, fever, and abdominal pain. One major causative virus here is the rotavirus, which is responsible for about 50 to 80% of all viral gastroenteritis. And this virus is very, very important for children. It infects mostly children of below 5 years and below. And that is why this disease is calling the attention of WHO right now, because it's the major cause of death, especially in the developing countries. Rotavirus. Again, what's the next virus there? That is the rhinovirus, responsible for most gastrointestinal diseases. And of course, the norovirus, which is also called Novak virus, is the disease, diarrhea of the no-rich, those who like going on cruise. They are acquired through contaminated shellfish, seafood, seafood, contaminated water during the cruising, during cruise. That's why norovirus can be easily acquired. Also, they are also referred to as winter vomiting disease. Oh, this one, liver infection. What's another name for liver infection? Hepatitis. Viruses are the major cause of hepatitis. And hepatitis can either, one important thing about hepatitis is that it can either be asymptomatic, That is, a patient is infected, but does not know that is infected. It can be mild, some can be severe or acute, or even fulminant or chronic. A percentage of infected patients will become chronic. Let me quickly also remind us here that hepatitis B and hepatitis C are the major cause of hepatocellular carcinoma. They are the major cause of death in hepatitis B or hepatitis C infected patients. Other viruses like HSV, you are already familiar with that word now. Herpes simplex virus, CMV, cytomegalovirus, and rubella can cause acute hepatitis as part of their systemic infection. This is really very, very important. Let's see the next category, urinary tract infection. This is not very, very common with viruses, but however, hemorrhagic cystitis have been linked to viruses. What is hemorrhagic cystitis? Inflammation of the bladder, of the urine bladder. Also, viruses have been the major common causes of infectious causes of myocarditis and pericarditis. What is myocarditis? Myocarditis is the inflammation of the heart muscle, while pericarditis is the major cause of the inflammation of the heart cover. The culprits here are the Coxsackie B viruses, Coxsackie A viruses, and the ECHO. What do I mean by ECHO? Enteric cytopathic human orphan. They can lead to cardiovascular diseases. Dengue virus and some other arboviruses, I'll be talking to us about arboviruses in the next slide. Dengue virus and some other arboviruses like Lassa, Ebola, they cause hemorrhagic fever leading to shock syndrome. That's why they are referred to as hemorrhagic fever viruses. They lead to shock syndrome as a result of excessive vascular leakage. Let's see the next category. Oh, I like this one. Nervous system infection. The one I really want us to pay attention to here is the rabies. It's the rabies virus. Rabies is a zoonotic disease which is acquired through the bite of a rabid dog, a rabid animal, a bat, a vampire, raccoon, and a vampire bat, and so on and so forth, and bats. So the virus travel through retrograde axonal travel to the CNS. The picture on the right, on the left, is demonstrating how the virus travels from the bite side through to the skeletal muscle and until it gets to the central nervous system, where it causes all the damage. It's characterized by fever, headache, muscle spasm, hyperactivity, even an infected man barking like a dog, unusual behavior, phobia, fear of water, fear of light, because of the paralysis of all the central nervous system, coma and death. I need to quickly remind us here that clinical rabies will almost eventually lead to death. That is why prophylactic, pre-exposure prophylactic is treatment. It's very, very important in rabies because of the long incubation period. But once clinical symptoms appear, it's very, very rare for the patient to survive. The next category is skin, mucosa, and soft tissue infections. These are diseases associated with localized infection and warts. A major causative agent here is the human papilloma virus, the agent that is responsible for human warts and cervical cancer. Some produce exanthemas and anetems in form of maculopapular rashes. HPV, I told you just now, is the major cause of cervical cancer. Other viruses that are associated with this group are HSV, VSV, HSV6 and 7, human papillomavirus, which is also referred to as B19, measles, that childhood disease, rubella, Coxsackie, ECHO. All these viruses will also produce rashes in their host. They all produce rashes in their host. Let's see the next group of viruses as they occur, as they cause multi-organ sicknesses, diseases. Congenital and neonatal. What do I mean by congenital? That is malformation, deformities in fetus, yet unborn fetus, exposed during one of the three trimesters, either the first, second, or third semester, depending on which type of the virus we are actually dealing with. A very important virus under this category is the HIV, which is transmitted through placenta during vaginal birth or through breastfeeding. Even when the child is born already, through breastfeeding, an infected mother can infect his baby through breastfeeding. Again, under this one is the hepatitis B virus, which can also be transmitted by other body fluids to infants born to chronically infected mothers. Let's see the next category as I'm almost coming to the end. Arboviral diseases. Arboviral or zoonotic diseases. What do I mean by arboviral? Arboviral means arthropod-borne diseases. Arthropod-borne diseases. Arthropod. What are those arthropods? Mosquitoes, ticks, mice, and other related insects. When they are infected, when an infected arthropod, insect, or mosquito, when they bite a susceptible patient, they can transmit the disease. They can transmit the disease to that patient. A very good example here is the yellow fever virus, dengue, which is also called the breakbone fever because of the terrible backbone that is also associated with this disease. West Nile, which was well recognized somewhere in East Africa along the West Nile coast. The Zika, which was 4 years ago, which was recognized in Brazil, and the major cause of microcephalus in unborn babies. Again, I've talked to us about rabies, which is a zoonotic transmitted through the bite of a rabid dog. As I come to the end, let's quickly see the last one, sexually transmitted disease. What do we mean by sexually transmitted disease? Those are the diseases that are transmitted through sexual intercourse. They are transmitted through sexual intercourse. A very good example here is the HIV, human immunodeficiency virus, human immunodeficiency virus, HSV 1 and 2, and human papilloma virus. HSV 1 and HPV are usually associated with genital warts, which is represented in the diagram on the right. On the lower right, or lower left, is the white in females, lesions, HPV lesions found in males, and the upper left, is in female. HIV is the major cause of genital ulcers, whereas HPV is the major cause of venereal wart and cervical cancer. So I think that is all of the slide I have for you today. I hope you have enjoyed my slide. I want you to subscribe if you are not subscribed, or if you have subscribed, please share. Students, share among yourself. Colleagues, share among yourself. Nurses, students, all of you share among yourself. There are vital information contained in this short video. I expect to see you in my next video. Meanwhile, I thank you very much for being part of me during this video. I hope to see you in my next video. Please don't forget, subscribe, share, and like.